When Matthew was probably 18 months old, we were out for ice cream and his sundae had like a peanut butter candy on top. He was eating the ice cream, no problem, and then he suddenly started to scratch his tongue. But nothing ever developed from it. When Matthew was about 2, we had him tested for allergies, kind of thinking of that day, and it was determined that he was allergic to peanuts, tree nuts, also shellfish. I really had no experience with food allergies at that time, and I was very uneducated. Several months after that, it was me who gave him a chocolate that had peanut butter in it, and it was in my own haste and not really fully paying attention and not fully recognizing the severity of food allergies. And it wasn't until he had developed hives and was having trouble breathing that I realized what was going on. It took actually 3 doses of epinephrine to get him stabilized to be able to get in an ambulance and go to the hospital. I had no idea that it could be so severe. So that really changed the way that we lived.
For all my life, I've just eaten what my mom has given me, but I'm sure her preparing all of that is really stressful, like going to the grocery store and needing to read the label on every single thing that's there. For Halloween, my mom was really good about explaining to me how dangerous these candies were. When I was little, the first thing I would say before I would say trick or treat was, I have a peanut and tree nut allergy. And then I would say trick or treat.
It felt paralyzing for our whole family. It felt like food was the enemy, that the world was a scary place. And I questioned as his parent what his future was going to look like. His allergist recommended XOLAIR as monthly injections to Matthew.
What is XOLAIR? XOLAIR, omalizumab for subcutaneous use, is an injectable prescription medicine used to treat food allergy in people 1 year of age and older to reduce allergic reactions that may occur after accidentally eating 1 or more foods to which you are allergic. While taking XOLAIR, you should continue to avoid all foods to which you are allergic. It is not known if XOLAIR is safe and effective in people with food allergy under 1 year of age. XOLAIR should not be used for the emergency treatment of any allergic reactions, including anaphylaxis. Important safety information. What is the most important information I should know about XOLAIR? Severe allergic reaction. A severe allergic reaction called anaphylaxis can happen when you receive XOLAIR. The reaction can occur after the first dose or after many doses. It may also occur right after a XOLAIR injection or days later. Anaphylaxis is a life-threatening condition and can lead to death. Go to the nearest emergency room right away if you have any of these symptoms of an allergic reaction: wheezing, shortness of breath, cough, chest tightness or trouble breathing, low blood pressure, dizziness, fainting, rapid or weak heartbeat, anxiety or feeling of impending doom, flushing, itching, hives or feeling warm, swelling of the throat or tongue, throat tightness, hoarse voice, or trouble swallowing. Your healthcare provider will monitor you closely for symptoms of an allergic reaction while you are receiving XOLAIR and for a period of time after treatment is initiated. Your healthcare provider should talk to you about getting medical treatment if you have symptoms of an allergic reaction. Do not receive and use XOLAIR if you are allergic to omalizumab or any of the ingredients in XOLAIR.
So much of our culture revolves around food. For him to be able to go out into the world and to not be afraid to ask a host at a birthday party or another function, is this safe for me? It definitely feels good. Food allergies can be stressful and challenging. He will still always need to read food labels, but he's doing very well, and so am I.
Before receiving XOLAIR, tell your healthcare provider about all of your medical conditions, including if you have a latex allergy or any other allergies, such as seasonal allergies. The needle cap on the XOLAIR pre-filled syringe contains a type of natural rubber latex. Have sudden breathing problems, bronchospasm. Have ever had a severe allergic reaction called anaphylaxis. Have or have had a parasitic infection. Have or have had cancer. Are pregnant or plan to become pregnant. It is not known if XOLAIR may harm your unborn baby. are breastfeeding or plan to breastfeed. It is not known if XOLAIR passes into your breast milk. Talk with your healthcare provider about the best way to feed your baby while you receive and use XOLAIR. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I receive and use XOLAIR? When starting treatment, XOLAIR should be given by your healthcare provider in a healthcare setting. If your healthcare provider decides that you or a caregiver may be able to give your own XOLAIR pre-filled syringe or auto-injector injections, you should receive training on the right way to prepare and inject XOLAIR. Do not try to inject XOLAIR until you have been shown the right way to give XOLAIR pre-filled syringe or auto-injector injections by a healthcare provider. Use XOLAIR exactly as prescribed by your healthcare provider. The XOLAIR auto-injector, all doses, is intended for use only in adults and adolescents aged 12 years and older. For children 12 years of age and older, XOLAIR pre-filled syringe or auto-injector may be self-injected under adult supervision. For children 1 to 11 years of age, XOLAIR pre-filled syringe should be injected by a caregiver. See the detailed instructions for use that comes with XOLAIR for information on the right way to prepare and inject XOLAIR. XOLAIR is given in 1 or more injections under the skin, subcutaneous, 1 time every 2 or 4 weeks. In people with food allergy, a blood test for a substance called IgE must be performed before starting XOLAIR to determine the appropriate dose and dosing frequency. Do not decrease or stop taking any of your food allergy medicine or allergen immunotherapy unless your healthcare providers tell you to. You may not see improvement in your symptoms right away after XOLAIR treatment. If your symptoms do not improve or get worse, call your healthcare provider. If you inject more XOLAIR than prescribed, call your healthcare provider right away. What are the possible side effects of XOLAIR? XOLAIR may cause serious side effects, including cancer. Cases of cancer were observed in some people who received XOLAIR. Fever, muscle aches, and rash. Some people get these symptoms 1 to 5 days after receiving a XOLAIR injection. If you have any of these symptoms, call your healthcare provider. Parasitic infection. Some people who are at a high risk for parasite worm infections get a parasite infection after receiving XOLAIR. Your healthcare provider can test your stool to check if you have a parasite infection. Heart and circulation problems. Some people who receive XOLAIR have had chest pain, heart attack, blood clots in the lungs or legs, or temporary symptoms of weakness on one side of the body, slurred speech, or altered vision. It is not known whether these are caused by XOLAIR. The most common side effects of XOLAIR in people with food allergy: injection site reactions and fever. These are not all the possible side effects of XOLAIR. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 800-FDA-1088 or www.fda.gov/medwatch. You may also report side effects to Genentech at 888-835-2555 or Novartis Pharmaceuticals Corporation at 888-669-6682. Please see full prescribing information, including medication guide, for additional important safety information.